It's recording, so we can start whenever. All right, so this is the Canada healthcare system in review. This is a quick table of contents, just going over all the topics that we'll be covering. So Canada overall has a decentralized universal system publicly funded by the health system called the Canadian Medicare. It started with the Canada Health Act of 1984, which sets these national standards for medically necessary hospital, diagnostic, and physician services. While there's many shared qualities of the US and Canada healthcare systems, the differences will create a longer life expectancy for consumers in Canada, and those differences are what we'll be covering in this PowerPoint. On the left is just an overall organization of their system.
And so, yeah, who's insured? It's everybody. Everybody in Canada has public coverage, which is basically Medicare. And then as you can see, the graph there, it says 67% of Canadians have private coverage. Residents in Providence is the only basic requirement to have the Medicare. No transient tourist or visitor is eligible for this. And supplemental insurance through Providence is provided for seniors, children, and social assistance recipients. This kind of goes over insurance plans need to comply with the 5 pillars of the Canadian Health Act to receive full federal funding. So it needs to be basically public administered. It needs to be operated a nonprofit basis by a public authority. Comprehensive and coverage conditions must ensure all medically necessary services provided by hospitals, physician, and dentists when they're performed in the hospital. The Canadian Health Act does not set these requirements, and the provinces and territories for the healthcare plan insurances do this with their own physicians, colleagues, and groups. Universal just means that all residents in the provinces are covered. Portable across provinces means no matter where you move to in Canada, all residents are covered. You do have to apply if you move to a new province for their insurance, and there is a 3-month gap waiting period for that. Accessibility is all residents must have reasonable access to medical services, needs to be based on their needs and not by their ability to pay. Like I already said, the 3-month waiting period, and then each province has their own determining minimum requirements, but most basic ones are that you have to be there for 183 days annually and must show proof of intent to return back to the province. If you are gone longer than the 183 days, you have to restart and reapply and have the 3-month waiting period again.
So is insurance compulsory? The short answer here is no for both. However, to go into a little bit more detail, the universal care is free and automatically provided to all citizens and permanent residents of Canada, meaning there's no way to avoid coverage. You get it automatically. This means individuals are not required to acquire care on their own. The Canadians can acquire private coverage to pay for excluded services, but it's in no way, shape, or form required. International students are the one exception. If you're going to study in Canada and plan on living there during that study, you will have to acquire your own health coverage. This is pretty similar to the US in that the coverage is not required on a federal level. Some states do require coverage, or individuals could face a penalty tax. However, this is only in 5 states and DC. With this being said, no legal action would be taken for individuals who are not covered.
So who pays? In summary, a lot of the provinces and territories cover most of the costs within the Canadian healthcare system, whereas a lot of private insurance in the US covers payments. So on average, US consumers pay about $10,000 per person and Canadian consumers pay about $7,000. This difference is kind of based on their own insurance plan. They each receive a cash assistance from the federal government based on a per capita basis. And then the benefits and delivery approaches may vary from there. It's organized by the Canadian province and territory governments. They each have primary responsibility, whereas most Americans get their insurance through their employer. The federal government co-finances their universal health insurance programs and administers a range of services for certain populations. This regulates the safety and efficacy of medical devices, pharmaceuticals, et cetera, and administers several public health functions on a national scale. However, all citizens and permanent residents receive medically necessary hospital and physician services free at point of use. 2/3 of Canadians have private insurance, and to pay for these excluded services, including outpatient and prescription drugs and dental care and all of that for all the targeted groups. There is no cost sharing for publicly insured physician, diagnostic, and health hospital services. And in 2016, out-of-pocket payments were estimated to represent about 15% of the total health spending. The majority was spent on non-hospital institutions, prescription drugs, dental care, and vision care. Providers are paid by mostly the PT governments directly, although some are paid by a salary by the hospital or facility. Lastly, patients may be required to pay the out-of-pockets for services that are not covered by the public insurance plans.
Okay, so then for how payments are made in the Canadian healthcare system, the Canadian healthcare system is often just thrown out as being free, but the money does come from somewhere. Typically, most Canadians don't pay upfront for their healthcare services. It's typically taxed, and about 70% of the payments that help keep the healthcare system afloat is through taxes by Canadian citizens, and that's taxed by just citizens and also permanent residents. So at times when they do have private coverage, like as mentioned, about 2/3 of Canadians do have private coverage, they are able to make separate payments like out of payment costs, similar to how the United States people may pay monthly premiums for their healthcare costs. And with those that are taxed for the regular provided healthcare, that's typically about 23% of each Canadian's annual income. And when and if there is a financial difference, like for services that aren't covered, typically Canadians are able to do payments through a number of ways that are pretty similar to the US, like checks, money orders, credit card payments. If they do have health credits provided to them by the healthcare system, they can pay with those, and through specific Canadian financial institutions like banks.
So now we're going to be touching on who has access to care. Even though there is universal healthcare in Canada, it's important to ration who receives care first. It is impossible for any country in the world to just provide every single citizen with any healthcare service that comes along. So this is why we have to ration in order to control the costs and resources. So in Canada, yes, you can purchase private insurance, but it's illegal for wealthy individuals to purchase private insurance in competition, where they can essentially just buy their way ahead of the queue. There are wait times in Canada because of the universal healthcare system. So this is in place in order to prevent disparities of people just buying their way to the front of the line. So similar to trends seen in the US, Canadians in urban areas also tend to have better access and coverage to care, as in a rural area where there may not be as many facilities for them to receive care at. And then over here on the right, we just have a nice visual about some more access for the Canadian healthcare system. So a little bit more about rationing. In Canada, healthcare is rationed with wait times, as I previously had just mentioned. They limit their supply mainly for elective procedures. So obviously, if you need something that can save your life, that's going to come before someone who is receiving more so of a elective or cosmetic procedure. Canada does have a better balance of rationing care than we do in the United States. And they are also able to better balance equal access concerns with their cost efficiency, government funding in both the private and public sector. Longer wait times in Canada are a result of them being fiscally conservative. In the United States, however, healthcare is rationed with price and ability to pay. This is very often seen with narrow insurance networks. This is the main way that we ration healthcare in the United States, unfortunately. It tends to be if patients want a specific service and if they cannot afford the copay or the out-of-pocket costs, they are often just going to postpone or avoid it, which is going to result in poor healthcare outcomes. And a lot of times it even results in them needing more services because of them avoiding it. Rationing in healthcare also results in those with lower incomes being the most affected in America more specifically. So just a little brief summary, Canada does have better access to care than the United States, and we ration in both countries. It's just done a little bit differently. You're either paying the price financially or within wait times.
So in Canada, with differences in accessing healthcare, it just depends on the services that are needed. So specialized care services on average are more difficult to access, and specialized care services would be those specialties like gynecology, cardiology, podiatry, things of those natures, versus first contact care services, which is things that we would essentially go to urgent care or the ER for. Like if you have an accident, if you have COVID-19, or an onset of an illness that needs immediate attention. So of course, something that is non-emergent or something that could be taken care of by your primary doctor, you're going to have to wait a little bit longer to get those services and schedule those appointments, versus their first contact care services, which once again is referred to as emergency services, where you will receive care more immediately. Statistically speaking, Canadians on average stated that they had more issues accessing care for their primary care services or specialized care services versus those who needed first contact care services. So it's just easier to go to urgent care in the ER versus getting those appointments with their primary personnel. Most of those who reported having issues accessing care, it was primarily those who were needing to have those follow-up visits after their first contact care services. So for example, if they went to the ER and they got a diagnosis, well, then they had to wait an extended period of time to get the follow-up with the specialized care services. For those who did say that they had difficulty accessing services, it was primarily waiting too long for an appointment and trying to find the, I guess, correct primary care service that would follow up with them. Because the issue is in Canada, when the first contact care services are used, you then have to still go on a wait list depending on the urgency. So for example, if your condition is not still after your first contact care service visit or ER visit, if it's not determined to be, your prognosis isn't determined to be terrible per se, then you have to go on a wait list versus someone else whose condition and prognosis outlook is worse off. But statistically overall, 71% of Canadians reported not having any issues accessing care. Other things that may limit or be an issue for Canadians in accessing care are transportation services, depending on where they're located to get to their specialized care services, if it's out of their area. Another issue would be their age, sex, and their immigration status. And all those things relate to the system on how the care services are distributed and ranked based on the prognosis. So for example, if someone is 70 years of age and they need a heart transplant and a 18-year-old needs a heart transplant, well, after the ER visit and they go into the surgery, they go into the wait list, then of course they're going to provide those services first to the 18-year-old versus the 70-year-old. So those are kind of some of the difficulties. Earlier on in the presentation, we discussed how based on provinces and areas that you had your insurance, well, it's also the same for your immigration status. So if a person obviously doesn't have the proper paperwork or, immigration status for the Canadian government, then they're going to also have other issues accessing that healthcare system.
So as a final comparison, overall, the US healthcare costs have higher rates and unexpected costs that further the negative effects of inequities. Whereas in the Canadian healthcare system, you have lower cost per person due to negotiation, but those with higher income pay higher taxes. For access, you have fewer general practitioners rationed with the price and ability to pay, whereas in the Canadian healthcare, you have more general practitioners per capita, which increases the access, but rationed with wait times. For the quality, you have lower quality despite high costs and overutilization. For the quality in Canada, the provinces have agencies responsible for producing healthcare system reports and for monitoring system performance. When it comes down to efficacy, you have the rising costs with less than desired outcomes in the US, which is what we've discussed in the past with our textbook. And then in Canada, you have it's similar to the United States with high taxation and out-of-pocket costs for care. And lastly, for equity, people must purchase the coverage, whereas in Canada, all citizens are covered. And that's all. Thank you so much for your time, and yep, hope to see you in the end. All righty, and I'm gonna